Good afternoon, class. My name is Joey Lamont. I'm here today with Colby Atkins, and we're going to be simulating a scenario where a very active 27-year-old male reported to the athletic trainer or medical with a sprained ankle or chief complaint of pain in his right ankle. He was running out in the woodland type area, and it was probably on mile 3, and tripped over a branch and felt a snap or pop and heard a pop, and he reports a 7 out of 10 pain. So when he comes in, obviously we're going to get basic vitals, information from him. The special tests we're going to do are talar tilt test and anterior drawer test. And both will be positive. We're going to see edema in the area. We're going to also see ecchymosis, which is discoloration, very common. Very commonly accompanies the edema. And so the course of treatment for this is going to be, we're going to refer him to an X-ray. He's going to be on crutches for 5 to 10 days, and we want to begin rehab within 48 hours. As long as with patient comfort. So the rehab exercises that we're going to be doing are a plantar flexion calf raises, which are going to build strength, and then for mobility we're going to do the gastrocnemius towel stretch. So we're going to do the calf raises. We're going to do 2 to 4 sets of 10 reps. So go ahead and stand up. All right, and go and face that way. Okay, so for the calf raises, we're going to have him lift his heels off the ground as high as he can, and then down, and that would be 1 rep. We can have him do it on one leg once he builds more strength. So if he lifts a leg, he'll have something to support himself. And he'll lift on that leg and then back down. Okay, so he's going to, once again, he's going to do 2 to 4 sets of 10 reps. I like to have my patients do it every day. And they're going to do this for about 4 weeks. The next one, so he's going to go ahead and sit back down. And the next one he's going to do is the gastrocnemius towel stretch. So he's going to sit back in the position he was originally, and he's going to pull on his ankle just like that, and he's going to be stretching out the calf, building the mobility. Something that wasn't in our text that I like having a lot of my patients do is drawing the alphabet with their foot or grabbing a towel with their toes. That'll really help the tibialis anterior muscle. For grabbing the towel with the toes and then doing the alphabet will really help the mobility of the ankle. And he's going to do the towel stretch 2 sets of 40 reps, once again for 7 every day for 4 weeks. And then with a grade 2 ankle sprain, you're going to want them to do it even after the injury is healed to maintain strength and mobility. Okay, so the next thing we're going to do is go over how to tape the ankle. So if you don't have pre-wrap, you can use Coban, which is what they always give you after you get blood taken out. Okay, you are going to start up higher on the ankle, and Coban can get pretty tight, so just kind of relax it. You don't want to, not trying to put anything on too crazy. It's not as easy to work with as pre-tape, pre-wrap, but definitely does the job. And anytime you're wrapping the ankle or any joint, you always want to wrap in the direction of supporting the injury. So if he did an inversion like he did for the inverted grade 2 ankle sprain, I'm going to want to create support up and out laterally. Alright. Okay. Alright, so now I'm going to do my anchor straps. It's been a little while since I've taped someone up. Alright, so now that we have those, we're going to go and do the stirrups. And remember, the whole time we're going to have them dorsiflex, so that way we ensure a good tape. So we're going to do 2 to 3 of these. And for those of you at home watching, forgive my dog in the background. He just really enjoys this kind of stuff. He just wants to be up in the mix. All right, and then now we're going to do the collar. So what we're doing here is supporting the Achilles tendon and providing additional compression around the ligaments. All right, let me do this one more time. And making sure it's dorsiflexed. And let me know if it gets too tight. All right, so we can do 2 to 3 of those, and then we're going to begin doing the figure 8. And this is definitely somewhere where you want to be careful with how tight you do the wrap. And then we can do a heel hook. Go over. Oh, that's not very good. Okay, so we can do one more. And then we would just close it up from here. Make it nice and pretty. Then you have your finished product. It can definitely be prettier. There's some athletic trainers that are turning over in their grave right now. But the goal is to provide support and compression for the injury. And once again, you want to make sure you're taping in the direction to support the injured leg. And then after that, he's going to continue, like I said, doing crutches, rest size compression, elevation, and do the rehab exercises we talked about. Okay? Thank you for your time. Have a great day.